This video is designed to help you with preparations before and after your total joint replacement surgery. A few of the items we will be going over include communication with your team of caregivers, packing the appropriate clothing for your hospital stay, as well as what you must bring to the hospital with you and what you should leave at home. We will also cover what you can expect the day of your surgery and as you are in the hospital recovering. It's recommended that you call your health insurance company to confirm that your surgery has been pre-authorized. You may also want to ask them questions about your copay and what services are covered once you are discharged from the hospital. Several days prior to your surgery, you will receive a call to register you for your hospital stay. You will be asked questions about your insurance and may also be asked to pay your insurance copayment at that time. The day before your surgery, you will receive a call from one of our nurses who will answer any of your questions and instruct you not to eat or drink anything after midnight. The nurse will also confirm what medications you should take the day of surgery. Be sure to let the nurse know about any changes you have had with your medications, or if you have been sick, had a cough, or feel ill in any way. During this call, you will also receive the arrival time that you will need to check into the surgical services area the day of your surgery. The arrival time is approximately 1.5 hours before your actual surgery. If your surgery is on a Monday, you will receive this call the Friday before. Following surgery, we encourage you to change into your own clothing as soon as you feel up to it. You will want to pack 2 sets of comfortable clothing to wear for physical therapy. This usually includes t-shirts, shorts, or sweatpants with drawstrings. If you are having knee or hip replacement, please keep in mind that the dressing on your surgery site will be quite large, so bring some pants that will fit over the area. If you are having shoulder replacement, it's recommended that you bring shirts that button down the front. Most patients prefer to wear the hospital-provided socks for their physical therapy. But if you would like to wear shoes, please ensure that they are fully footed shoes and not slippers. You are welcome to bring your own hairbrush, toothbrush, and toothpaste. If you wear dentures, you can bring your own cup to soak them, or the hospital will provide one for you. If you wear hearing aids or eyeglasses, please bring their storage cases with you. For your protection, it is required that you remove all jewelry prior to surgery. This includes wedding rings, watches, and all body piercings. If you use a CPAP, please bring it with you when you check in for your surgery. Be sure to have your name on it, and our caregivers will make sure that you have it during the recovery phase. We ask that you leave all of your medications at home. We will have a list of your current medications, and our hospital pharmacy will provide them for you while you are in the hospital. There is free Wi-Fi internet in each hospital room to allow you to use your personal electronic reader or a laptop computer. Please pack them if you would like to utilize them during your hospital stay. Please bring your insurance card and photo ID with you to surgery check-in. We recommend that you take these 2 items out of your wallet and give them to a family member who will be accompanying you to the surgery for safekeeping. Leave your wallet at home, as there is no need for money or credit cards during your hospital stay. On the day of your surgery, please utilize Sevier Valley Hospital's ER entrance. Continue to the surgery waiting room and check-in area located northwest of the emergency room on the hospital's main floor. Once there, check in with the receptionist at the desk. They will ask you to provide your insurance card and photo ID. They will also have you sign admission papers, consent forms, and have you verify that the information on these forms is correct. After you are registered, you will be taken back to the pre-op room. You may bring 1 or 2 family members or a significant other with you, and they will be able to stay with you until you are taken to the operating room. You will be weighed and measured and asked to change into a hospital gown. Your nurse will then take your vital signs, review your health and medication histories, ask when you last ate or drank, and verify any medications that you took that morning. An IV will be started to provide fluids and medications that will be given to you during surgery and your hospital stay. You may be asked to take an oral medication, and you will receive an antibiotic through your IV to help prevent infections. Your nurse will then complete a skin prep on the operative joint, which may include hair removal with clippers and a scrub with antimicrobial soap. Prior to surgery, you will meet your nurse anesthetist, who will talk to you about your anesthetic choices, which may include general or spinal anesthesia based on your health history and preferences. The nurse anesthetist will also discuss pain management, which may include a nerve block based on your health history, surgeon's preference, and your personal preference. The nerve block will be administered prior to surgery in either the prep room or the OR. You will also have the opportunity to talk to your surgeon and OR nurse prior to surgery. This will allow you to ask any last-minute questions that you may have. Be sure to speak up if you have any concerns or questions about your operation. Your OR nurse or nurse anesthetist will then take you back to the operating room on a gurney. At that time, your family members or significant other will be asked to wait in the OR waiting area. You will be in surgery approximately 1.5 to 2 hours. After your surgery, you will be taken to the recovery room where you will stay for about an hour. During this time, your surgeon will talk to your family members or significant other in the waiting room area to tell them how your surgery went. Your family members or significant other will be given your assigned room number on the nursing unit and invited to wait there for you. After recovery, you will be taken to the nursing unit where you will stay until you are ready to be discharged. On the whiteboard in your room, your team of caregivers will write their names, the date, your pain goal, and your goals for the day. They will also educate you on your medications and any side effects that may occur. There is also a place on the whiteboard where you can have your caregivers write answers to any questions that you may have. To help you feel safe and secure after your surgery, we want you to understand the different devices that may be used to help you heal in the best way possible. You will be given oxygen after surgery. At this point, you may be a little sleepy, and this supplemental oxygen will help provide adequate air while you rest. The nursing staff will monitor your oxygen levels frequently and will remove the oxygen at the appropriate time. The IV that was placed prior to surgery will remain in your arm until discharge. The nurses can disconnect the fluid during your physical therapy sessions, but you may need to be hooked back to it periodically to receive medications. Some patients also have a urinary catheter. This is a tube that is placed in your bladder to drain the urine into a bag. This helps to prevent you from getting up to go to the bathroom as often and also aids your nurses in monitoring kidney functions and hydration levels. Usually, you will only have the catheter until the next day, and it will be taken out as soon as possible. All patients will have special boots on their legs called sequential compression devices, or SCDs. These boots will be wrapped around your legs and they will expand and deflate as air is pumped into them. This squeezing motion may be uncomfortable at first, but don't be alarmed as the compression will help the blood circulate back to your heart, helping to prevent potential life-threatening blood clots from forming. It is important to wear the SCD boots every time you are in bed. Another device that will help you while you heal is called the incentive spirometer. A respiratory therapist will teach you to use this device to do special respiratory exercises. Doing these exercises will help to prevent certain complications such as pneumonia. You may have a wound drain to collect excess drainage from your surgery site. If you have one of these, it will be removed before you go home. One of the most important things to help you in recovery is participating in physical therapy. Your first session with a physical therapist will generally be the day after surgery and will continue in your home after you are discharged from the hospital. Ask a family member or significant other to be with you during your sessions to help you with the exercises after you leave the hospital. This video shows the general flow and process of a total joint replacement. Your procedure may vary a little depending on your specific needs. If you have questions, please ask your doctor or nurse. We appreciate you trusting Sevier Valley Hospital with your healthcare needs.